I'm Lilith. I'm one of the NHS100K crew. We're here down at Downing Street today after a very happily successful day where we've made a stand against vaccine mandates, and we are willing to throw in the job, give Boris back his jobs if he continues with these mandates. We do not want these mandates to come into NHS, because once it's in with the NHS, next will be teachers, next will be police officers. It will go through the whole of society, and this is not what we stand for. We're more about the individual right to choose, bodily autonomy, and especially for healthcare workers, where we have to inform people about their healthcare choices and give them the options. We must allow them to choose. We don't want this ability to be removed, because we do believe that each and every individual person has the right to choose, and they know their health best. And when you remove that right and you make a government responsible for your health, it's not something that we want to see happen in our society. I'm willing to lose my job for these vaccine mandates. I don't want them coming in, and this is my stand to say no, it is not acceptable. Afterwards, we'll find jobs in other places, but it's very likely that mandates will come into there. Because if it is about protecting the vulnerable, where do the vulnerable spend most of their time? In society. So if in care homes you've got everyone mandated everyone has compulsory vaccinations in a care home, and that's enough. And in the NHS, if 90% of the staff are vaccinated, and that's not enough, and most of the vulnerable people spend their time in society, and 80% is not enough, how much is enough to be safe against COVID? It should be down to your individual choice. Today was a really, really good turnout. I was really proud of everyone for coming down from all the areas that we're connected to. On our channel, purely with Telegram, we've got 9,000 subscribers, but we're also on Twitter, Instagram, and Facebook. And it looks like today there was about maybe thousands of us here. And I do encourage them to stand strong and say no and not cave in, because it's just wrong to be forced to be vaccinated. We all know that we don't want this, and in our hearts, it's just heartbreaking to choose between our jobs and this jab. We don't want it. This is another point that we want to make as well. The NHS is already under staffing crisis. Last I checked, it was 93 vacancies, and you want to get rid of 100,000 more staff. This isn't just healthcare. This is going to be affecting admin, logistics, delivery drivers, people who are working in the kitchen, laundry, even people working in the morgue, for goodness sake. Anyone who has the chance of passing a patient is being told that they need to be vaccinated. This is going to be affecting a lot more than anyone realizes, and the NHS is already under pressure, struggling to cope. You can't afford to lose us. If you want a public health, you need to keep us in the job. You really need to weigh up COVID to public health, because COVID right now is such a minuscule amount with what we deal with as healthcare workers. Public health needs to get back on track. These delays cannot happen anymore. I think it was 6 million on a waiting list, or 6,000. Well, a big number on a waiting list. We need to reduce that. If you get rid of us over COVID vaccinations, you will further delay your healthcare and getting treated. So this needs to stop.